Obamacare coverage choices depend on where you live. Make MSN your homepage. Sign in. MSN News. MSN News. Web. Images. Videos. News. Maps. Search. Home. Thus 2016 election blog. Recall report blog. Crime and justice. World. Science and tech. Pop culture. In-depth. Photos. Video. Health coverage options under Obamacare depend on where you live. AP photos. File. Marcellus Owens of Seattle. Left. Representative. John Gill. D. Michigan. Right. And others. Look on as President Barack Obama signs the healthcare bill in the East Room of the White House in Washington. 1 day ago, Ricardo Alonso Zaldivar of Associated Press. Share. Tweet. Email. Obamacare may be a national law, but as key provisions take effect October 1st, political battles mean where you live can make a big difference in coverages. Washington bureaus having health insurance used to hinge on where you worked and what your medical history said. Soon that won't matter, with open access markets for subsidized coverage coming October 1st under President Barack Obama's overhaul. But there's a new wild card, something that didn't seem so critical when Congress passed the Affordable Care Act back in 2010, where you live. Entrenched political divisions over Obamacare have driven most Republican-led states to turn their backs on the biggest expansion of the social safety net in a half-century. If you're uninsured in the state that's opposed, you may not get much help picking the right private health plan for your budget and your family's needs. Related, what Obamacare type are you? The differences will be more glaring if you're poor and your state rejected the law's Medicaid expansion. Unless leaders reverse course, odds are you'll remain uninsured. That's because people below the poverty line do not qualify for subsidies to buy coverage in the markets. We are going to have a new environment where consumers may be victims of geography, said Sam Carr of the California Healthcare Foundation, the nonprofit helping states tackle practical problems of implementation. If I'm a low-wage earner in California, I may qualify for Medicaid. With the exact same income in Texas, I may not qualify. AP photo. File. In this March 27, 2012 filed photo, Amy Brighton, from Medina, Ohio, protests against President Obama's healthcare law in front of the Supreme Court in Washington. The healthcare law is finally leaving the drawing boards to become a real program with citizens participating. But in many parts of the country, the decisions of Republicans opposed to the law will trump the plans of Democrats who wrote it. Still, there is a new bottom line. Health insurance marketplaces in every state will provide options for millions of people who don't have job-based coverage, who can't afford their own plan or have a health problem that would get them turned down. The feds will run the markets in states that refused to do so. Related, Republicans weigh defunding Obamacare in U.S. spending measures. The coverage won't be free, even after sliding scale subsidies keyed to your income. That's significant because starting next year, most Americans will also have a legal obligation to get covered or face fines. Some people who now purchase bare bones individual plans will complain the new ones cost too much. Others, in good health, may resent the government telling them to purchase insurance they don't think they need. Nonetheless, the number of uninsured people is expected to drop markedly, bringing the United States closer to other economically advanced countries that guarantee coverage. The combination of subsidized private insurance through the new markets, plus expanded Medicaid in states accepting it, could reduce the number of uninsured by 1/4 or more next year. Current estimates of the uninsured range from around 49 million to well over 50 million. Related, healthy young adults may keep Obamacare afloat. Related, hipsters, Paul Bunyan make pitch in Obamacare ads. As Americans get more familiar with the law euros and if more states accept the Medicaid expansion euros millions more should gain coverage. Many of the remaining uninsured will be people living in the country illegally. They are not entitled to benefits. In Texas, Republican Duff Rick Perry has vowed not to facilitate Obamacare. But Cecilia Fontenot of Houston is looking forward to the opening of that state's federally run insurance market. Related, Obamacare's individual mandate. What are the rules? A part-time accountant in her early 60s, Fontenot is uninsured and trying to stay healthy while coping with diabetes, high blood pressure and high cholesterol. She walks twice a day, early in the morning, before it gets hot, and in the evening.